For a case of dysphonia or hoarseness, using our mnemonic old carts as our guide, we'll note the onset or when did your hoarseness start. For the duration, we'd like to know if you're constantly hoarse throughout the entire day or if it occurs more intermittently after certain activities, for example, a class. If it is intermittent, we'd like to know how long are you hoarse for and how many times per day. Next, we'll want to ask about the progression. Does your hoarseness appear to be occurring more frequently or more severely, as we might expect in a case of laryngeal cancer, as we'll see below? Or if there has been no progression, we'll also want to state that in our patient note to show we've asked. To help characterize the hoarseness, we'd like to ask if there's a sensation of a lump in the throat, any pain on speaking or pain on swallowing, aggravating and alleviating factors, and treatments tried. And again, if there are no aggravating and alleviating factors or treatments that were tried, we'd also like to state that in our patient note to show we've asked. For all cases, let's order a CBC, serum electrolytes, an ultrasound of the neck, and a laryngoscopy. In hypothyroidism, our supporting points will include hoarseness, fatigue, weight gain, cold intolerance, constipation, and dry skin, and we'll add to our workup a TSH T4. In gastroesophageal reflux disease, we'll see hoarseness, dyspepsia, which can be broken down into any of the 3 points, heartburn or epigastric pain, early satiety or fullness, or nausea. We could see a cough that tends to be dry, and since it is a bodily fluid, we'll use our mnemonic A, B, and C to write down for our patient note the amount, if there's any blood, and the color. GERD will tend to be aggravated by meals, lying down, or at night, and alleviated by antacids or sitting up, and we'll order an H. pylori test and endoscopy. In a laryngeal polyp, we'll see hoarseness, the sensation of a lump in the throat, cough if the polyp is irritating the larynx, and since it is a bodily fluid, we'll use our mnemonic A, B, and C, and a history of heavy voice use, for example, a singer, teacher, or drill instructor. In laryngitis, we'll see hoarseness, the sensation of a lump in the throat, the characteristic upper respiratory infection symptoms, including a runny nose or cough, and for both, we'll use our mnemonic A, B, and C, possibly a fever, a history of a URI if it's acute, or chronic smoking or GERD if it's more chronic. And if we're concerned for a URI, we could add a respiratory viral panel. And finally, in a laryngeal cancer, we'll see hoarseness, the sensation of a lump in the throat, a cough, and we'll use A, B, and C. And now we could expect to be seeing possibly blood in the cough, cervical lymphadenopathy, and the characteristic weight loss and decreased appetite seen in cancers. And also our patient will have a history of smoking, heavy alcohol use, and an age greater than 50 years old. And we'll order a CT of the neck and chest.
We'll start the pulm exam with hand sanitizer, and we want to ask our SP if we have our permission to examine you. Okay, after he said yes, we'll start with the hint exam. For the eyes, we're primarily concerned for conjunctivitis, for a URI, so we'll ask the patient to look up. So we verbalize there's no conjunctivitis, no parlor. Ask him to look down and verbalize no scleral icterus, no conjunctivitis as well. And then we could also quickly assess the nose to see if there's any rhinorrhea, if he has any runny nose or congestion, and we don't see it. And then we could go ahead and look into his oral pharynx. So we could do that with the tongue depressor. And we want to use very light pressure for these SPs. We don't want to cause them any pain, so ask them to stick out their tongue and say, ah, and we'll look around and say that there's no visible lesions. The oral pharynx is clear of exudate. On to lymphadenopathy, so we're going to go ahead and inspect his cervical lymphadenopathy. So we'll start over here. Next, we're going to go ahead and do submandibular, submental. Okay, we're going to do preauricular and postauricular, do occipital. And we want to do supraclavicular, so please shrug your shoulders. Okay, good. Okay, so we had no lymphadenopathy. We want to look at the thyroid. So the first thing we'll do is we could visualize the thyroid and see if there's any visible lesions. And a good tip is to offer the patients a glass of water to see if it will help them swallowing. Would you like a glass of water to help swallowing? Okay, so the next thing we could do is then feel for the thyroid. So we ask them to take a swallow. Okay, and we don't feel any masses, and we could do one on one side at a time. And then with the thyroid, we're going to introduce this mnemonic that we'll see again with the MSK exam, which is MSRP, and manufacturer suggested retail price. And so this mnemonic will help guide you, along with the thyroid exam, the other components to look or to check for thyroid issues. So we'll start with the M, which is motor. So ask the patient to please make a muscle, and we'll test his motor strength. So he has 5 out of 5 flexion and 5 out of 5 extension. Okay, after the motor on the upper extremity, we'll do the same thing on the lower extremity. So we'll ask him to please kick out. Okay, good, and now please kick in. Okay, great. We're going to go ahead and move on to sensation, the S. There's no real need for sensation like a neuro exam for the thyroid, but we're used this opportunity to let it hold as a placeholder for cyanosis and delayed cap refill. So we'll go ahead and look at his fingernails, and you don't see any cyanosis. We could press on his fingers, and we don't see any delayed cap refill. Okay, next we're going to go to reflexes. So we're going to start with the biceps, and we'll position our thumb on his biceps tendon and just instruct him to relax. Okay, and we'll see a 2+ reflex, and we'll do the same thing on his other side. Okay, good. And now we're going to go ahead and do the same thing on his lower extremity, his patella. So we'll instruct him to just relax, please. Okay, should give us a reflex. The SPs are trained to give us a good reflex. Okay, there you go. Okay, and now we're going to go on to pulses, and so we'll check the radial pulse, and you could do one at a time, or if you're a little more comfortable, you could do two, and you could comment that it's a 2+ pulse, regular rate and rhythm. And go ahead and do the same thing on the bottom. So we're going to check his posterior tibial pulse. So it will be behind the medial malleoli. We can go ahead and do one at a time, or if you're a little more comfortable, you could do two at a time. Just comment that it's 2+ regular rate and rhythm. And now once we're finished down there, it's always a good idea to hand sanitize again. So now we can move on to the palm exam. And so for the palm exam, the best way to do this is to drop down the gown halfway and ask the patient to please sit across your arms here, and this will hold the gown and keep them protected. So the first thing we want to do is verbalize that there's no visible lesions to the anterior chest, to the posterior chest. Next we'll palpate. So we'll palpate his chest and just ask him if you have any tenderness there or pain. Tenderness or pain. Do the same thing on the back. Okay, and now that we've done that, we could go ahead and we could percuss. So we're going to go left to right, 3 spots. Okay, now we're going to go ahead and listen to his lung fields. We'll use the bell of the stethoscope for his above the clavicle, so you want to instruct them every time you feel the stethoscope, please take a breath in and out. Okay, that was a good equal breath. Okay, so now we can make a comment that we heard clear breath sounds, no audible wheezing. We want to use economy of movement to make use of the time and listen to his heart sounds. So the mnemonic we're going to use is the Parmet M225A. So we'll start off with his aortic in the second intercostal space on the right. Go ahead to this pulmonic, tricuspid, and mitral. And if this was a female patient, you could ask them to please lift up your left breast. We could comment that we heard an audible S1, S2, no audible S3s or S4s or murmurs, rubs, and gallops. This was a case where we were concerned about mono in a palm case. This would be a good time to do the abdominal exam because we finished his upper chest, so we could lie them down. So is it okay if I lie you down? Okay, good. Ask them their permission, and you don't want to forget to extend the leg rest. Start the same way. We'll verbalize that we don't see any visible lesions, and we'll go ahead and progress to auscultation. So for the abdominal exam, we want to auscultate first in 4 quadrants. Okay, and we could verbalize that we heard normal active bowel sounds, and then we'll go ahead and percuss in the 4 quadrants. Okay, and we want to ask them if they have any pain first. You want to avoid those areas. So do you have any pain anywhere? No. Okay, so we'll start in the lower quadrant here, and we'll do superficial first just with one hand. We could make good eye contact with the SP to see if they have any pain or if they wince. Painful at all? Okay, now we'll go ahead and do deep, and for that we could just signal we're going to put one hand on top of the other. Any pain at all? Okay, so no pain. And then to conclude, if we were concerned about mono, we want to check hepatomegaly or splenomegaly, so we want to place our hand under his liver. You can instruct them to please take a deep breath in. And now as he breathes out, you don't want to feel anything, any liver border below the rib cage. So once you feel the rib cage and nothing extending further, you can make the comment that there's no hepatomegaly, and you could do the same thing on the swing side. So you could please take a deep breath in. Okay, and now breathe out. And then you can feel the lower border of the left rib cage and no organ extending below it. Okay, so now you can cover them up again. And then you want to help them sit up. And then just ask them if they have any questions. And then that would conclude the exam.